The law school of medicine was one of my top choices because when I came here on my interview day, I found that the medical students were really competent. They were amazing. The culture at the Long School of Medicine was the type of culture I could see myself being in. And also I found that the faculty were amazing, that there's a lot of broad subspecialty exposure to medicine, and I felt like I needed that going to medical school. And I guess on a personal note too, I found that San Antonio is a great place for me to be able to raise my own family. I think it's really important that as we're going through medical education, we don't lose the humanism and the compassion that we have for patient care. And I feel that the Long School of Medicine has been a great place to cultivate that. I chose the distinction in medical education because I loved being a teaching assistant during my undergrad, and I felt like that would be an important part of what I wanted my medical career to look like. I really enjoy working with medical students, and I could really see myself becoming an educator in the future. And I wanted to have the skills and the experience to be able to bring that with me into residency as I care for patients and teach students, and eventually become an attending physician with that skill set. Early in my medical school career, I wanted to become a geriatrician. And I felt like even now, there's a huge need for education around geriatrics and caring for older adults as our population gets older. And so I was able to find some great mentors who helped me to incorporate some more geriatrics curriculum in the preclinical years of medical school. And so I was able to create some sessions, invite some panelists from the community to help educate our medical students. And those have so far been actually integrated into the curriculum. And now currently, as I'm pursuing a neurology residency, I've been able to create a workshop to help students improve their neurological exam skills. So I'm actually on a monthly basis, I'm teaching medical students who are going through the neurology clerkship how to better examine their patients. And just from all this, it's been a great opportunity to improve my own teaching skills, and then also be able to prepare myself better to become a physician. I think it's really important to be a good educator just for patient care by itself. I think being able to have the skills of knowing how to teach someone about their medical condition, how to take care of themselves. So having that foundation of education is important for that role. I also think it's important that as I'm working as a resident, working with students, and eventually I hope to be in an academic setting working with other residents, I think it's really important to not only know to be an educator, but also know how to educate and put together curriculum and other sessions that really help students and learners to grow into the physicians they need to be.